All right, welcome everybody to this week's Indies of Color discussion. Today we are talking about the fourth trimester, which is the period after you've given birth that people largely do not talk about. So I thought it would be great to talk about this because, again, people don't normally talk about this. And women and men, but women who have given birth often don't really know what to expect. They don't know about some of the changes that their bodies are going through. Their bodies are going through. They don't understand some of the fluctuations that are happening. So I wanted to have these experts in this area, this childbirth and postpartum period, to come on and share their expertise and just sort of give you some information so that if you or a woman you know is pregnant or has already given birth and is still feeling some of the changes, that they can know what to do, what to expect. They can know what's normal, what's not normal, when to see a doctor, when to be concerned, all of those things. So without further ado, I'm going to have my guests introduce themselves, tell you who they are, and basically how they got into postpartum care. So let's start with Dr. Calina.
Hey everyone, I'm Dr. Calina, also Dr. Williams, whatever you feel like is comfortable for you. I am located in Phoenix, Arizona. I'm a graduate of SCNM, that's Southwest College of Naturopathic Medicine. I graduated in 2012 and I have been doing birth work since 2011. I'm a naturopathic physician and of course I specialize in the home birth setting.
Thank you very much. Thank you very much. Dr. Mahi.
Hi, I'm Dr. Mai Heath. I'm a naturopathic doctor. I went to the Canadian College of Naturopathic Medicine in Ontario and graduated from there in 2013. I'm also a labor and delivery doula and really more of a full spectrum doula at this point. I've been attending births for over 8 years now. What brought me to kind of this naturopathic doula work was really the birth of my own children. I was in naturopathic medical school and I delivered my first 2 children. And being out of the country, was able to have a doula when wasn't able to have family nearby. And that really piqued my interest and, really got onto it from there. I started attending births in Ontario and now I practice in Chicago. So attend births in the United States as well. And I'm a highly specialized doula. Not only do I work with, the prenatal or the perinatal time, I also work with moms that are teens. I work with moms that are in high-risk situations. I work with moms who are incarcerated, and I work on a team with moms that also specialize in working with moms with opioid abuse disorder. So that's, a lot of my life is birth work.
Excellent. Thank you very much. Thank you very much. All right, who's next? Let's do Dr. Pierre.
Hi, everyone. My name is Dr. Pierre. I am a naturopathic physician as well. I graduated from Southwest College of Naturopathic Medicine in Arizona in 2015. I specialize in fertility, hormonal imbalances, thyroid disease, everything leading up to the birth process. And I also support women after they have had their babies. I got into this work a long time ago. In the mid-2000s, I worked at the Brooklyn Hospital Center and I was a prenatal health educator. So I kind of started the process there. I actually considered becoming a doula at that point as well, because I was so enamored with the pregnancy process. But I didn't. I wound up going to naturopathic medical school and just made women's health a focus of mine. And currently, as I mentioned, I help support women throughout the whole process. So I'm really happy to be here.
Excellent. Welcome, welcome, welcome. Now we have Dr. Lahnor.
Hello, everybody. I am Dr. Lahnor Powell. I graduated also from SCNM, which is the Naturopathic College in Arizona. And that was in 2010. Currently, I am a functional laboratory consultant. I work with Genova Diagnostics, which is a functional laboratory company. But what started to transition me into more of this fourth trimester postpartum health and care is actually the birth of my own 2 children. And from those experiences, I basically developed a website called Love and Lullabies. If you'd like to go check it out, that's really cool. It's loveandlullabies.org. And it's basically a fourth trimester health and wellness blog where I talk about a lot of common health concerns that you don't necessarily hear from your practitioners, or that you might not necessarily hear from other women, as they may be a little bit timid in sharing those things. So I'm just kind of coming out into the light and sharing everything from hemorrhoids to sex. These are very important topics that we need to address during that fourth trimester time frame. So that's a little bit about me.
Thank you. And Dr. Michelle.
Hi, everyone. I'm Dr. Michelle Brown-Echerd, and I graduated from NUNM, which is in Portland, Oregon, in 2014, and I went back a couple more terms to complete the Naturopathic Midwifery program there. I got interested in birthing and supporting people in births due to my own children also, who are now 19 and 20 and were born at home with not much support at all. And I wanted to give back to community and be there as a safe person inside of a home, and as a doula inside of hospitals also. I trained at 2 hospitals before I shadowed a naturopath midwife. I trained in 2 hospitals with a perinatologist in Oregon and 1 in Washington. And I'm currently in Maryland, so I'm licensed as a naturopath in Oregon, Washington State, and Maryland. And I'm completing my requirements for the Naturopathic Midwifery license out of Oregon, which is a specialized degree. And I can go on from there and do some other states as a midwife after taking the NARM exam. So I'm getting more active in trying to get those requirements completed. And as a naturopath, I've primarily been working with families, a lot of immigrant families and large families. So I see just different stages of their life and their interactions, and just try to be as supportive as I can. And I do a lot of training and have a lot of experience with cultural competency, and just trying to connect people with resources. So as a naturopath, I'm doing a lot of social work also, just helping people with food security and unemployment and anything current, such as COVID now, just trying to get information out that's easy to understand for people that don't have English as the first language. And it's been really exciting, and it feels really good to be a part of birth work, just because it's like you're joining those families almost, like an auntie or a sister of the parents. So I'm grateful to be here. Thank you.
Thank you. Thank you. And I am Dr. Turshá Hamilton. I am currently in New Orleans, Louisiana. My focus is diabetes, hypertension, and digestive disorders. So I don't really have an expertise in this area, which is why I wanted to gather these doctors who have this area. I just know how important it is. So my first question for you all, and the reason why I'm asking this is because I've had an experience, is how long is the postpartum period?
Well, for me, I think it depends on how you're looking at it definition-wise. Mm-hmm. So if you're looking at the definition is from birth to 6 weeks. Now, there's a difference between, for me, the postpartum period and the fourth trimester, and then healing. Those are 3 different things. We use those terms interchangeably. The healing process, how long does it take? But you need more than 6 weeks. Let's just go ahead and throw that out there. You need more than 6 weeks. When I think about the fourth trimester, I think more about, it's just like you have mesters, all the first and second, about 3-ish months after you've given birth. But the process of healing that could take a year, 2 years. You know, it depends on the woman. It depends on the support system that she has. So those are 3 different terms for me. But if we're just saying postpartum, 6 weeks.
All right, so the 3 terms, postpartum is 6 weeks. What were the other 2?
The 4th trimester. I know we say that the 4th trimester, about 3 months after. Just like every other trimester, approximately 3 months. There would be about 3 months after the birth. And then healing, of course, that depends on, you know, support system, the mom, her natural constitution, how she's doing in her health overall.
Thank you. Anyone else want to add to that?
I'd add, especially like when you think about doula work, like there's many different kind of doulas. One kind of doula are postpartum doulas. And, you know, postpartum doulas, they can work with the family depending on that family's need for an undetermined amount of time, you know. So, and also when we're looking at like mood regulation and we're looking at, you know, is mom having a mood issue that is specific to birth, then we're looking at that first full year, you know, the first 12 months. But certainly, you know, when you think about trimesters, we're thinking about 4-ish months, like Dr. Williams said. And I always kind of thought that baby sleep cycles often, you know, everybody's different, but often change around 3-ish months. So I always, you know, thought maybe that played a factor in the fact that there's, you know, that 4th trimester and it being that period of time. But certainly, you know, if you're working with a postpartum doula, like I said, it could really be indicative to what that family needs and still be, you know, referred to as the postpartum period.
Okay.
Absolutely. Just adding one more thing. Look at the term. It's postpartum. So it literally means after baby. So I think it's very unfair that we actually put a time frame on postpartum period. And the time frame, the 6 weeks, I think that's more of an American, a US definition. Because when you start to go into other countries or you start to research other practices, they're looking at 9 months, 6 months, you know, 3 months, 12 months. So I think that's a term that we have defined here based on changes that occur during those first 6 weeks. And that's why usually we actually have our postpartum doctor's visit is actually at 6 weeks, because again, this is a definition that we have here in the US that I think from what's going on right now, COVID, we're now starting to get the ammunition to challenge this actual definition.
All right, I love that you brought that up, Dr. Lahnor, because exactly what you said, it varies depending on where you are, because my family's from the Caribbean, they're from Haiti, and there's lots of rituals that are performed after that point, very beautiful rituals, like certain baths and things that respect that time frame. So I love that you brought that up, because we've kind of created this narrative of what that period should be. And like the other lady said, it can't be limited to this idea because there's so much more. And then when we talk about even postpartum depression and what women are dealing with, you know, we see that that period can extend so much longer. I love that you brought that up.
Yeah.
And I like what everyone said so far. And Dr. Powell, I think about what you said, and in the US, especially thinking of that 6 weeks, that definition, and some sources would like to say it should be a minimum of 12 weeks. And it's just, it can be frustrating when dealing with like insurance or practitioners. If you're a midwife and you're not a doctor, it's like you're not really supposed to see that baby after 6 weeks, or if it's insurance, they don't want to pay for 12 weeks or, you know, 4 months of care. And I think that's a little bit of a challenge, because it feels rushed if somebody has their own timeline where they want care. I mean, inside of their own families, that's, you know, not necessarily a timeline unless it has to do with going back to work, but just having support people and doulas and payments and different things. I think it's hard to not really have a say in what that person needs for that postpartum, for both baby and mom, and getting resources and changes and growth. So, and it's good with the naturopaths that can be involved in the births, because then there's not a timeline on age either. It can be from, you know, babies all the way up to geriatrics. And that's one thing that I really like about my education and licensing, to just be that support person that can be there for long term if needed.
Absolutely. Thank you. So let's talk about some of the changes that occur. So woman goes into labor. I was about to say go into the hospital, but that's clearly not the only option. So a woman goes into labor. She's having contractions. She has a baby. What are some of the changes that do happen or that can possibly happen during immediately after the baby, and then, you know, some weeks and months later that people either know or don't know?
Well, oh, please go ahead.
I immediately postpartum, I'm thinking about, you know, lactation, if that's what that laboring person chooses to do. If they're, you know, decide to feed that child or the children from their body, then, you know, there's the hormonal changes that affect your body with oxytocin, prolactin, in that period of time. You know, you can expect that to happen usually within the first 3 to 5 days. You know, there's a first milk that comes in, and then, you know, as your body regulates, it could take weeks really for a regulation of milk production and things like that, but your milk will usually come in that time frame. So that's one of the things that I'm thinking of changing immediately postpartum. And, you know, that's really happened. Those changes are happening because of, you know, that process of that mother-baby separation.
Yeah.
You know, those hormones are flowing because of that actual birth experience. And then the next thing, you know, that I'm thinking about are continue to be hormonal changes, and then how that can affect mom and baby sleep, and how that can affect mom and family's mood. So those are the probably the like most acutely things that I think of postpartum, just to start.
Thank you. Dr. Powell?
So I'm a person of props, so y'all gonna have to excuse me. One of the things that I really like to highlight to people is the amount of blood and fluids that are lost, okay? And so when you have a normal, I don't wanna say normal because that's not fair. When you have a vaginal delivery, you lose approximately 2 cups of blood. When you have a C-section, you lose approximately 4 cups of blood. And so that is something that I think a lot of people aren't really aware of, the amount of blood that's being lost. But let's keep it real. You're not only growing a baby, but you also have a whole nother organ called your placenta. And so after you deliver, all of these things causes your hormones to shift. And as Dr. Mai said, I mean, your hormones, your estrogen, which is like your female hormone that gives you your breasts, your lips, and your hips, that basically, along with progesterone, it plummets. They say to the level of people who are menopausal. And that allows the milk production to come in. You know, we have all these endorphins going on for about 48 hours or whatever time frame. I think it's about first 48 hours we have those endorphins. These hormonal shifts, that's what allows your milk to come in. I think I said that, sorry. And all these other things to kind of change. But also what people don't realize is you deliver your placenta. So now you have a wound, right, in your body. And then your uterus now is like, okay, great, we have an open sore. And it needs to close this open sore. Much like a tourniquet, your body starts to have these crazy contractions. And that's what people call afterbirth. That's something else that happens. And it basically provides like a tourniquet to cut off blood supply so that, you know, you don't lose too much blood, or you don't hemorrhage. Other things you might experience, it could even be difficulties with urination or passing a bowel movement, because again, with these shifts in hormones, it changes those basic functions. I had 2 emergency C-sections, and so I had a catheter. And that changes your bladder function. Plus, I have all these different medications that were used because I had emergency C-sections. And so that also, again, it just shifts so many things. And it's amazing what your body actually goes through in those first few hours after you have a baby.
Anybody else want to share on that one? Or did they cover it up? Pretty much covered it.
Everything.
Okay.
I have something.
Oh, okay. I'm sorry.
And it's not really necessarily the birth itself. It's just a topic I think that's not talked about a lot. It's kind of the emotional and the social aspect I had, and particularly I'm thinking in Oregon where cannabis is legal for recreation or even medicinal, and having patients at home births transport, and as a student, the student and the doctor would follow them to the hospital and stay the whole time. And if there was anything in the chart or any reason, without disclosing to the mother, they might do the urine analysis on the baby. And so like some of the changes is, oh my gosh, I just had a baby, I'm so happy, my family, my baby's healthy. And then to have the social worker come in and said, we found, cannabis on this drug screen. That's just like the emotions are, it's already exhaustion and joy and fatigue and fear. And then all of a sudden something else might happen, where the outside world is kind of coming into your family as a threat. So I've seen that before, where mothers didn't know that was a thing in a state like that, but because they get national funding, it's not necessarily legal for their employees or for their patients. So just, kind of telling people, even if you start at a home birth, you might not actually finish that. So it's kind of one of those things you kind of want to boost somebody that you're not doing anything wrong, and they're not going to take your baby away, but it's definitely something nerve-wracking that they need support with, even if it's from the doula or doctor or midwife.
Thank you. Dr. Calina?
Some other things that we tend to overlook include the thyroid. The thyroid actually does take quite a hit after giving birth and can slow down quite a bit for us. So that can lead to a lot of things, being tired more, not to mention you're feeding a baby every 2 hours, so then you're extra tired just because you're doing more, but then your thyroid is not helping you out anymore either. So that can also, of course, then contribute to the baby blues that we are probably going to talk about later on. But the thyroid can definitely take a hit. For the ladies who care about how we look, of course, we all do. A lot of times your skin will take a hit as well. It'll start to get dry due to your thyroid changes. You can get hyperpigmentation that'll occur, so you have like a big line, the linear niger going down your belly. The ladies don't like that. Your stretch marks start to come in a little bit more. We don't like that as well. And then of course we already talked about the GI changes that occur. You're eating, your whole digestive system slows down quite a bit immediately after you give birth. And so like Dr. Lahnor said, I think I'm saying that right. There's a decrease in digestion. You have a lot of constipation. You're not urinating quite as much as you usually do. Hemorrhoids, can be a real big thing, especially if you had a vaginal delivery. Those are all things that people often will have difficulty with immediately, following the birth of the baby.
I just wanted to say, what's interesting about this is we're talking about all the symptoms. And so for people who may not know or who haven't been pregnant, what happens to the body is everything shifted because of the baby's presence. And so when you're hearing these doctors talk about these different changes that are occurring in the body, this is why. And I find that a lot of women, a lot of patients have this confusion about, like, I feel like my body is all over the place. That's like a common statement because your organs literally have shifted. So when we talk about constipation and your bladder and urination and all these kinds of things, every single organ has been affected by this pregnancy process. And this is why you're hearing some of the symptoms that we're talking about.
Thank you.
Hair loss.
Yes.
I was just about to say.
These are the hormones.
Postpartum hair loss. Yes.
Yeah.
And blood clots. I think that was one thing. I've had 3 children vaginally, and my last child, I had some really, some some larger blood clots pass than I had experienced before. So, you know, even as a third-time mom, I was like, is this within normal limits? And I reached out to my midwife, and she assured me that it was. So that's something else that, you know, in the middle of the night, you might, you know, get a scare about, or your partner, you know, if you have one, you might get a scare about. So that's something else that you can kind of something to breathe about.
Oh, two more things. Number one, your sex life might actually change too, right? Because all of a sudden, all of a sudden, right, as I mentioned before, your hormone levels, like your progesterone can increase by like, you know, thousands, right? Like it increases hugely. Your estrogen increases hugely. And then all of a sudden it plummets. And, you know, estrogen is needed for, you know, kind of vaginal lubrication. And so it changes your sex life. And now you have this different, these different hormones like oxytocin, all this stuff. And that's called, a lot of people call that like your bonding hormone. And you bond to the baby so tightly, sometimes the spouse, you know, sometimes it's a little bit different, right? But I think the last thing that I think like blew my mind was dental issues, right? Okay, so basically you got a lot of blood flowing and everything, so people notice that they have more bleeding gums, but pregnancy alters the bugs. Everybody has bugs in your mouth, don't get grossed out by it, but pregnancy alters the bugs, the microbiome in your mouth. And so that's why you hear women losing teeth when they're pregnant. That's why you hear women with gingivitis when they're pregnant, you know, all these things. And so that's something else that I was just like, what? And then the swelling, it does not stop after you deliver. So those would just be the last few things. Sorry about my computer going in and out, y'all. I'm sorry.
That's okay. It's fine.
I definitely want us to touch on the sex portion.
Oh, that's already on the list.
Okay,
it's on the list. It's on the list. We're going to get to that. We'll probably end up with that because I could tell that's going to be part of a good conversation.
Good.
So before we get to that, I recently found out that, and when I say recently, I mean like a week or two, that there's a difference between the baby blues and postpartum depression. So would you all please explain that? Because like I said, I, as a naturopathic doctor, just found out about this a couple weeks ago. So what's the difference? Baby blues, postpartum depression.
I guess I'll just go. Baby blues tends to be something that is very transient. Mothers will likely get a little sad. We've already talked about the great fluctuation in hormones that occurs immediately after giving birth. So remember that the mother's entire family dynamic has changed, whether she's a first-time mom, second-time mom, whatever the case may be. As soon as that baby is born, everything about her life changes. She now is responsible for taking care of this human being. And this human being is calling upon her every 2 hours to feed me, to change me, whatever the case may be. And I have had, my hormones have changed. My body has been through many, many different things, right? Quite a large change. And for me to be tired and to have feelings about that, and you know, and be weepy, that's normal. That's a thing that happens from time to time. Now, if we're looking at it from the medical perspective, this should occur somewhere within that first week-ish to 10 days, where you should start to feel that weepy-ishness. You know, you're talking with your husband and you're like, I want orange juice, but I want it on the right side. And it's like, it's just orange juice. It's just orange juice. It's okay, you know, but you're just weepy. You know, you don't know, and you will talk to the women and like, I don't know why. It really wasn't that big of a deal. I don't know, it just got on my nerves and I just started crying, you know, whatever the case may be. You just feel overwhelmed. You just don't feel quite right. That's a lot of times what women will say. So, and within it occurring a couple of weeks later, it's gone, right? Versus with postpartum depression, that can occur for months after the baby has born. I mean, when I say start, it can start anywhere from months after, not just a couple of weeks, and it will last for a long time. We're talking about for years. It may be much more exaggerated than just me feeling a little weepy or a little tired or not quite right. It's much worse. I don't feel like getting up out of the bed. I haven't been up out of the bed in a week. I haven't washed my behind in a week. I don't feel like it, and I'm not. And it can get to, a psychosis one, which is a totally different, where you're having visual hallucinations and you're getting to that point where you have thoughts that you don't want to have about your family, maybe about hurting someone or hurting yourself. So that's the difference. Am I just a little weepy? Am I just tired and overwhelmed with the process that's going on? I just want to cry for a little bit, versus going into that deeper portion where, you need help to get yourself out of that. I think that's all I have to offer. You guys take it on.
Yeah, interestingly enough, interestingly enough, I saw a study that said postpartum depression is actually the most common condition right after childbirth. So I thought that was really interesting because, when you're thinking of it, we were just talking about all these other things that go on, but we're not thinking of that necessarily as a condition, so to speak, but it really is that common. And I think when we acknowledge that and recognize that, it will help kind of get rid of that stigma around it, because I noticed that many patients and many women don't want to talk about it, don't know how to talk about it. And when I talk to patients, I kind of already broached the topic on how they should be prepared for this actually coming. So I recommend that everyone should have a therapist. That's just my, personal stick, because I was a mental health counselor for many years. So that's very important to me. And of course, that doesn't go anywhere when we're talking about women and pregnancy and the postnatal period. But having a therapist already on board to kind of walk you through that process can also be helpful. And not that I'm adding on to the amount of things that a new mom has to deal with, but the reality is it really is that common. And I don't think we take it seriously enough. I don't think physicians talk about it enough so that patients will be prepared for that period. So I think having a therapist already on board, especially right now while we're dealing with COVID-19 and we're expecting mothers to just manage through all of this without, any guidelines. And now the whole process has been turned upside down. So I think it's just important to just acknowledge how common this is outside of what stage it could be. It's incredibly common, and just supporting mothers on how to get through that and what to expect as that's happening.
Thank you.
Yeah, definitely that difference between baby blues and postpartum depression, like the two other doctors are saying, it's that rate and that frequency, or that duration rather, that duration and that frequency, the severity. Ooh, guys, look, this heat must be getting to me. I can't get my thoughts together. Okay, so yes, oftentimes those baby blues can be managed with supportive tactics, can be managed with strategizing, and is very transient. And then the postpartum depression oftentimes needing help, reaching out for talk therapy, reaching out for other therapies, reaching out for pharmaceutical therapies, that it might necessitate that. Also, I think it's important, especially in our community, to make sure when you're speaking with people that they realize what you mean when you say postpartum, because I feel like in our community a lot of times we say postpartum and we mean postpartum depression, but but we might be, birth professionals or might be talking about just the postpartum period of time. So I have had some miscommunications with people that I'm trying to support because of that, just that miscommunication alone. So I think that's worth just acknowledging or making sure that you're cognizant of your language around. And then I think Dr. Williams she touched on postpartum psychosis, but there's also something that maybe you have or haven't heard about, just called baby pinks. So it's that kind of moving towards a manic sort of situation, or really just an anxiety. And I believe I read somewhere that moms experience that even more. And there's a depression scale that's been around for a very long time, and sometimes I have problems with the way it's worded, but that's another conversation. But it's called the Edinburgh Postpartum Depression Scale. At your 6-week appointment, your medical professional should really be going over this with you, but they don't always. And I think it's really important to talk to families about self-assessment. They can actually assess themselves for the points that are brought up on that Edinburgh Postpartum Depression Scale, and be able to at least have a heads up about if they are like being able to manage the way they're feeling with supportive measures and strategies, or if they need more support.
Thank you, because I had no clue about that. Yes, ma'am. Dr. Calina.
I have something to add about the postpartum depression screening. Yes, everybody should definitely have the postpartum depression screening. What I've noticed in my practice is when I actually hand them that paper, especially within our community, there's this thing where when we see the word depression, we're like, ooh, something wrong. I don't want nothing to be wrong with me, right? So I tend personally to incorporate the screening questions in my own way into when I'm talking to them, as opposed to handing them that sheet of paper, because then sometimes people don't always tell the truth. They're like, sometimes, all the time, all the way, it's okay, I'm all right, because you want to fudge and tell yourself that you're all right. I really want to let my patients know it's okay to not be okay. Like, you have grown a full human being. It's okay to have, a little sadness. And if you let me know, then I can help you, versus trying to figure it out on your own. And so one of the things that I do to try to be a naturopath, and of course prevention is cure, is I try and do a postpartum plan. And I give that to the mother at about 36 weeks. So she has a full month to look at some of the things that she's going to have to deal with after birth that she probably wouldn't have thought about, so that she can go ahead and start putting things in order now. How am I going to feed myself? What am I going to do to take care of myself? Who's going to come over? Who's not going to come over? Those types of things that can help to make it a little bit better for you to understand it's okay that I'm a little weepy. It's okay that I'm tired. It's okay that I feel a little depressed, and I should be able to have someone to talk about that with.
Thank you. Thank you. So what would, that actually leads into the next question. What kind of support does mom need? And let me extend that to say, what type of things should mom and partner, what type of things should they have on their postpartum plan? Dr. Powell?
Yes, perfect. So there's quite a few things that should be discussed or should be on this postpartum plan that Dr. Williams just brought up, which I think is such a phenomenal idea. Number one, we need to discuss who do we want to visit, when do we want them to visit, and who do we not want to visit. You just do a process of delivering a baby. Your immune system is rendered susceptible. Your emotions are they just fluctuate all the time. There's a lot of things going on. And so you have to be very clear who you want to visit. And you do not. I birthed my children in January. That's viral season. So I don't want any old body coming through saying hi to my baby, picking them up, kissing them, and loving on them. So the next thing you have to start to plan is nourishment. So you need to have a bunch of vitamins, a bunch of minerals, a bunch of iron. There's a lot of different nutrients that are required during this time frame. And so freezing meals, I'm huge on freezing meals, preparing things ahead of time. Or even if you live in an area where you have local great restaurants, getting those menus and already having things set up. For my first birth, I had friends who actually got me Grubhub, and they put money to it. Just kind of decreasing what you have to be responsible for is tremendous. The other thing you will need that you might not expect you will need as much is rest. You need a huge amount of rest I'm an up and going kind of person, but the amount of rest that you actually need it's enormous. The other thing I think you need is wise support. people to be around you, people to uplift you, people to give you positive words of encouragement. And then I say pampering. So if you're able to, massages, acupuncture, me personally, even binding, like something to keep you, you know, like feeling snug and good. And then lastly, nature, vitamin D, air, wind. Not winds, not cold winds, but you know, you need nature. I think those are kind of the big things. And you have to also nowadays determine how you want technology to play a role in your postpartum time frame. But those are just a few things that I think about.
Thank you. Anyone else have anything to add to that, to the list? Dr. Michelle.
Sure. I worked with a lot of low income people and families. So I think before the baby's born, just knowing what resources you can get. If you need a doula, can you go to a school where there's somebody training and can do the work for free? There's the homeless population. There's different things. With the family dynamic, there could be domestic violence support that's needed. So some of this stuff is like the depression, the word depression, sometimes it's difficult to talk to the families and the individuals about these things because they don't want to feel like they're inadequate for this baby that's coming into the world, but they're just, you know, they're humans, you know, doing what we do. And that's, you know, I have a list for my doula clients just in their area. What are the food pantries? What are the places where you can get diapers and baby clothes and different things? Someone mentioned the meals, like meal trains and different things that can help you just, you know, be at the level that you can be, that you should be at even without being a new parent. And then I know there's the 211, there's the energy assistance and different programs. And it'd be better to do this before the baby's born, but sometimes circumstances change, like during, you know, around the birth where there's a job loss or there's a change in the relationship of the parents. So that's just something that I think of, a possibility for support groups. And I think dealing with not knowing what to expect if there's another child, like if there's another child that's going to be jealous or too excited, you know, how can you set the boundaries? Or, you know, I don't know about now with COVID, but just setting up, you know, play groups. And it's kind of weird, but in Portland, I did a lot of dog walking as a doula, because, you know, people, that was something, you know, playing with the older child for a couple hours while mom rests with baby, and then all of us going on a dog walk and, you know, kind of helping them with their regular routines and, you know, not wanting them to lift or have somebody tug them down the sidewalk.
Thank you. Thank you.
I love so much of what Dr. Michelle just said. I think it's really important what you mentioned about, you know, incorporating other siblings, having a plan for that beforehand, incorporating pets. If you know, you have a dog, you've got cats, there's different strategies and things that you can do to kind of incorporate new baby into that, you know, into that dynamic so that they can be safe. I didn't hear the word specifically, but I really heard people talking about setting boundaries, setting healthy boundaries. I really think that is part of the the parenthood journey, really. And that's something that can be set in place. I think that having a productive conversation around sleep deprivation with other adults that are in the house, whether it be a partner or other family members that you live with, if that's the case. Sleep deprivation is real. Sleep deprivation can very much compound mood. Sleep deprivation can be very hard on relationships, romantic relationships and things like that. So, you know I often come up with strategies with families for different ways to do it. It's such a highly specialized time. You really have to see what there's not a formula. You know, there might be tips and advice like, I find that people need this, but really you have to examine what an individual family needs and try to shore them up. And that's why one activity that I encourage families to do is to make a list of the concerns you have, fears, concerns, you know, and put them in two categories: things you can, you know, affect, things you can change the outcome of, and things that you can't, and you know, try to hit those sort of topics, and then the ones that you can't do anything about, try to find a way to sort of, you know, release that. I think two other things to be cognizant of, or to kind of have on that list, is just getting your mind right, a lot about the household. You know, it's not likely that however you kept your house before is going to be how you're able to keep your house after. And actually, that's something that I've been taught in my, you know, my education as a birth worker, is if you go to a home and it's immaculate and it's kept, and this mom's got, you know, a 3-4-day-old, then that could be an indicator of, you know, baby pinks, or that could be an indicator of anxiety, or a hyper, you know, a manic sort of situation. So just getting your mind right, thinking like, okay, it's not going to be the same, and that's okay. You know, maybe I get the willies when the beds aren't made, but postpartum, if they're not, you know, that's going to be okay. And of course, making a plan for vaginal healing if you have a vaginal birth. There's so many, someone said pamper, there's so many nice little, you know, treats that you can make for yourself, or other people can make for you before you deliver, and then you can come home and use those things to support your vaginal health, or even your health after a surgical birth, incision care, and things like that.
Thank you. So I recently read something that sort of touched on what you were saying about the, what do you call it, the food train, and it was beautiful. So the thing that I read was, if you allow people in your home afterwards, you know, to come see the baby or whatever, then don't let them come empty-handed. You know, everybody needs to pitch something in. If you're going to come into my home in this new environment, in this highly volatile environment, you have to contribute something. So that has to be either a meal, or you have to pick up and do a chore, or you have to do something. And if you give people that expectation ahead of time, then that will make life easier for you, because if they are allowed in your home, then they're not just going to take up your little energy, take up your time and space, they're actually going to be contributing. So I thought that was, you know, a beautiful thing to read. And I had never considered it, at least not in those terms. And I'd like to say that if you walk into the home of a new mom, don't ask her what she needs help with. She don't know. She doesn't know. The first time I experienced that was with a friend of mine who happened to also be a naturopathic doctor. I went to the house and I was like, you know, what do you need? What do you need? She's like, I don't know. And I'm like, how you don't know that you don't need? In my ignorance, I didn't know. But eventually I did what I normally do, and I started bossing her around. All right, you go take a bath, I'll take the baby, you do this, blah, 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 whatever. But I didn't realize that at the time. So again, don't ask mom what she needs. More than likely, she doesn't know. So if you are allowed in the house, pay attention to what's going on. Are the dishes, you know, do the dishes need to be washed? Does the floors need to be swept? Does mom need the dogs walked? Does she need to take a nap? Does food need to be cooked or refrigerated or thawed out or whatever? Pay attention to those things so that you can actually do something to help.
Dr. Turshá, as you're speaking and all the things we're talking about, it also sheds light on the fact that obviously our conversation is going to be mother focused, but how much of a toll this takes on the entire family. And we kind of alluded to that. And I know we're going to talk about the relationship part later.
That was actually the next thing that I was talking about.
I know,
so read right into it.
I feel it coming. But it's also like when you are coming and you're helping, that's taking the load off of the relationship as well. Mm-hmm. Because then there's fights and arguments about, you know, not getting enough help. And, you know, that's a common story that I hear, unfortunately. Yeah. And, you know, the mother many times does feel like she's left to figure things out for herself. I know many moms who they're trying to decide whether they're going to have another child or not. And what they're struggling with is, should I have another child because I feel like my partner is not helping enough? And this is not to bash, you know, the part, because this could be a woman. It's not just men, right? But it's just that's the other piece of this help, because the whole family is trying to adjust to this change of environment and situation. So when you're coming in and assisting, you're taking the load off of everyone and their whole family dynamic.
Yes, thank you.
That's very true, because children who were only children or the middle child, they go up in the list and they're not getting as much attention, and they want mom's attention. And the partner, you know, depending on who they may be working all day, and then they have to come home, and then they have to try and help, you know, as well. So it helps to have those, what I call wise women, women who are there to just give to you, to take off the burden that you have of day-to-day chores. Because somebody coming over and taking the kids means you get to get some sleep, means your husband gets to get some sleep, or your partner gets to get some sleep. That helps in the dynamic of your relationship. When both of you are worn out, you had the kids all day, he's been at work all day, then they come home and the kids playing and jumping all over, and you just like, I just want to sleep. But then when it is time to sleep, the baby's crying all night, and then you got to feed half the night, and you get no rest. So it helps to have that person to come over and say, you know what, don't worry about eating, about what you're going to eat, because I'm finna cook for you, I'm finna clean the house, I'm finna wash the clothes, I'm finna wash the dishes, everything will be fine, just lay there and rest. Yeah. That helps tremendously. So yeah, that's very important. It helps for the whole entire family, yeah, to have someone there.
And it's not just immediately after the baby is born. I actually met a friend of mine who, her baby was 7 months old. But when we met, like after a brief conversation, I could see that she was still exhausted. She was still in the middle of it. So, you know, I'm like, go take a nap. Here, go take a bath. Go do what you need to do. Relax, release. I'll take care of the baby. So don't just think about it immediately after mom gives birth, because she might still be dealing with this. And I'm specifically saying mom because she's the one who actually gave birth, right? So let's talk about the significant other, the spouse, the significant other, the other parent. What can the other parent do to help support mom? What can the other parent do to support themselves in this time, since everything has shifted?
I think the other person has to be more understanding and patient, and that may not be a natural trait that they have, but if they're listening to this conversation, you know, that's a huge part. It's, you know, the patience is going to have to increase, and the person that you knew prior to having a baby could be totally different at this point. And I think that can be hard for people to come to terms with, this idea that the person they knew now has whatever mood they have. They're really tired, so they don't want to participate in certain activities. They may be moody. They don't want to do anything. They may just want to sleep all day. And I think when we talked about the fact that that other partner is now coming home, we're not really considering what they now dealt with if they're working. And so now you have these two people who are coming together, potentially feeling all types of ways, maybe even resentful. You know, there's the period where the partner, they can't have sex, you know, for that 6 week, 8 weeks, whatever it winds up being for you, because we say that, but it can be longer for certain people depending on their condition. So now the partner is kind of like, I want some affection, I want some attention. And so when we're talking about this, is all these different ideas and feelings that are being thrown around and trying to be processed with this person who may not be who you thought. So there just needs to be a lot of patience for the mom in that scenario, because she's also feeling herself that like she's not herself, and trying to come to terms with that. And so now if you add added pressure or emotions or anger for how she used to be and now she's not that person, I think that's just a recipe for disaster right there.
I don't believe any person who has just given birth wants to feel like they're going at it alone. And by that, when, you know, that baby's going to get up in the middle of the night, it's going to happen. That baby's schedule is going to be all over the place. You know, newborns usually feed every 2 to 4 hours. So especially if it's over the middle of the night, when possible, be up with mom. If she's bottle feeding, if she's breastfeeding, be there to put that boppy pillow. Be there to get her an apple or some dark chocolate or something, some water. Be there to, you know, prop her up so she feels comfortable, or be there to make that bottle or to get those sort of things. And go ahead and stay up with her. If she's up, stay up with her when possible. That might, you know, like I said, it's so individualized, but when possible, that person who just delivered doesn't want to go through it alone. And when they can look at another adult and be like, okay, I can lean on you. We're in it together. Then I think emotionally, you know, that will build you up and help you to be able to persevere. I'd also say, you know, for the partners to be strategic in asking for help. Some people have problems asking for help. You know, I'm grateful I haven't tended to be that kind of person, but you know, a lot of people have a hard time asking for help. And I think that if the partner is there to be able to be strategic about that, I mean, we just talked about meals, and certainly, you know, naturopaths and birth workers, we have lots of ideas about and culturally speaking, all different cultures usually have specific foods that are, you know, helpful for the postpartum period, because like you said, digestion is different. We want things that are warming. We want things that are blood building and things like that. So, you know, one thing is when people are like, how can I help? You know, unlike Dr. Tursh's advice, if somebody comes in there and they're saying, how can I help? Always have a way that they can help. I don't hear nothing about, we okay, we good, you know, and take that burden off the person who just delivered. Come up with some ideas about how everybody who offers, you'll be able to make some good use of that.
And do that ahead of time, far ahead of time, because you can't think after you've given birth. You won't remember a thing. Have it on the list, post it on the refrigerator and say, I don't know, go look at the refrigerator and do something.
And the same thing for your coping strategies. I have a plan that I often share with families about. The plan was actually created by a company to help decrease the likelihood of trauma to infant head trauma. But what it is a list of you essentially identifying things that are soothing to you. You're identifying things as a caregiver, that strategies that help you to cope. And then as your baby gets older, you're also looking at the baby and identifying their specific nuances about things that they like and don't like. Well, you know, coming up with that list, you know, I like this playlist. I like this food. Reading this book helps, you know, or whatever. So that when you're like, I'm stressed, I'm not feeling it, you can just go and already know things that are soothing to you. So definitely thinking ahead. That's the name of the game. Stress management is the name of the game.
Thank you. Dr. Michelle, you were about to say something?
Oh, I was just thinking, someone mentioned that not using the word normal. So for the partners and the support network, just thinking of like the changes, the emotional changes. I've seen families where the parents or maybe the mother-in-law was going to stay with the family, and maybe before the partner didn't get along with the mother-in-law, like, and you never know, like there's always a little bit of like being nervous about, oh, is this gonna, you know, make my relationship more stressed? But sometimes things happen that aren't the way that they expect it. Like sometimes like they weren't getting along with the other relative, and then all of a sudden the baby's here and everything is great, or the opposite could happen. So just having the partners just be really open-minded and just know that there is going to be possibly oftentimes lack of sleep, and then different food changes, hormonal changes, and thinking about like families I've seen that were not getting along before the baby, the parents weren't getting along before the baby came, and then all of a sudden everything was great. And just helping the parents before the baby's born, just say, hey, you know, things aren't going to be the way they were before, even if you're an experienced parent. So just kind of get out there and, you know, let time be, you know, let time, when babies come, I feel like it's their time. So whoever's outside of that baby kind of has to fit into what's going on with the baby. And that's hard to kind of explain. I'm a really visual person. And then having that partner, I don't know if it's like, besides being a support network, I've had families where the mother of the grandmother of the baby is not a safe person. So it's almost like the partner can be a bodyguard in a way, or, we've had people that were not supposed to be at a birth that were outside waiting in the bushes, like peeking in the windows, like really having some people that you can't have that happening. And if the partner is up at night also, and knowing if the mother is sitting in a rocking chair or something, her body is healing and working. It's like sometimes partners could think, oh, that looks lazy, you should be up doing dishes, but it's like your milk is and you're working, you're having to digest those calories, you're having to deal with the mental, everything that goes with that. People think about, oh, I have to go back to my job next week, I'm gonna, I don't have any energy, I'm gonna miss my baby. So letting the partners know that there's a lot of things that moms think about and go through in their bodies that it's invisible. It's not like physical labor where you're up, laying bricks all day. It's so draining though. And then, thinking of how are you going to set boundaries with people that shouldn't be inside the house, or what is it going to take to allow those people in the house, which is another plan, which they both need to talk about. So if say the partner's family members don't get along with the mother and the mother doesn't speak up, like, oh, I'm not ready to have them over yet, or I'm not ready, if they want to drop off food, let them put it on the porch or something like that. Just making sure the communication stays open. I just feel like the lack of sleep that can happen, it kind of makes us forget what someone said. It reminds me of the list that someone just said about the things that are soothing. It's almost like having that toolbox of what I can do to help maintain some peace around here, and what we can do together to kind of help the family get a little boost, because we can't no matter how much caffeine someone wants to use, if they had been up for 2-3 nights in a row, they're just kind of spinning their wheels. So just being open-minded, communication, and then just taking it easy, and realizing, even maybe for the mothers, we've had the naturopath midwives like write a note to their employer to say, hey, they need another week off work, they're not ready, and that in itself, if mom is happy and less stressed, it usually radiates out to the rest of the family.
Thank you. Dr. Powell, were you about to say something?
Yeah, I just wanted to reiterate something that several of the beautiful doctors have already mentioned. You have to communicate and you have to plan ahead. And I think you do yourself a disservice when you start to compare your pregnancy or your postpartum healing journey, I'll call it that, with other people, or with your prior pregnancy. So you have to be very open-minded and wise and understanding and forgiving. And you just have to talk about everything and know that things are going to be different. And it's okay. You guys can work through it together. But, definitely having that spouse or whoever that wise figure is in your life to really just go above and beyond and try to anticipate what you might need. But I also think it's important to know your spouse's love language. That way you can start to integrate their love language intentionally into how you are reacting or responding to them. I think that's something else really important to know. And how do you cope with stress? Like a lot of people were saying, what's their way of, feeling better or improving? For me, it's puzzles, right? So I stocked up on puzzles before my delivery, But again, you prepare yourself as best you can, and you have to just be blunt, real, and communicate.
I'd like to add that, we're talking about having a plan, which is a must, but also be flexible enough for things to pivot, because things don't always go as planned. Things hardly ever go as planned. So if you have something in your birth plan, if you have something in your postpartum plan, be okay if things shift, because that's just how life goes. Don't let that add extra stress. Just be ready for that shift, but at least be prepared in some way for for the time period. Dr. Calina?
Oh, nothing. I'm sorry.
Oh, okay.
Just my ass. Sorry.
All right. So the last couple things. One thing, I wanted to read a comment that I actually got earlier in the week. She says, my son is 5 months. As a woman of color, sometimes I feel like I can't ask for extra help or for a break because I'm the one who got pregnant. It's my responsibility, especially with the way I got pregnant. Friends with benefits, my son's dad isn't present, so I try to push through it. What would be one piece of advice that each of you would give to that mom?
Wow.
I would say stop it. Stop it. You need to realize that we're human and we all have our breaking points. You cannot be fully present for your child if you do not take breaks, if you do not ask for help, if you do not rest, if you do not address your mental emotional situation. And people who are casting judgment based on how that child might have arrived here on this earth, they might not be the right people for your support system. So it might be time to find a new support system. People that can uplift you, people that can encourage you, people that will say, honey child, please leave that baby over here. Let me bring you, and accept the help they give you when they give it to you. Because that's a mentality that will drive you crazy. That's a mentality that will lead to increase in cortisol, which will negatively impact a whole bunch of things, right? Including your breast milk production. So what I would say to them is stop it. Find you the right support system, the right network, and move forward. Because you cannot be a present mama if you have not supported yourself, or if you have not allowed yourself to receive the love and the healing that you deserve. You carried a baby for 9 months. You basically rent-free a parasite that sucked everything it did from you for 9 months.
Yeah.
Then you deliver this thing. You are the OG 3D printer. You have to realize that it's okay. Ask for help. Receive help. Stop that thought pattern because it's destructive. Okay, I'm done. I'm sorry.
Thank you. Thank you. Dr. Pierre.
Oh my gosh, yes. So that comment makes me really sad, first thing. It makes me sad because it's just another reminder at how, I mean, this is my opinion, but I don't feel like we respect the pregnancy process enough in this country in particular. And the fact that that's one of her major thoughts out of all of this just makes me really sad. And not that it's her fault, but it's also making me think that there's more trauma behind that and guilt. And I like to say to people, I don't know what her religious belief is, but I say guilt is not from God. Guilt is not from spirit. Guilt is not from, if you want to call it universe, it doesn't come from that place. Guilt is all bad. It's all negative. And I understand that, Dr. Lahnor said some beautiful things about getting a new support network, which I think is major. Unfortunately, sometimes people in this time period don't have anyone. This person to me sounds like they don't even have it. So hopefully they can move forward and find some supportive people, maybe some people in their neighborhood, maybe some people in their church, maybe some people from their job. A lot of people will find support networks in their job unexpectedly after having a child. But, those thoughts are just all bad, and it's nothing positive. And like Dr. Lahnor said, that there's no way she can get to a positive healing place with that kind of thought process. So I'm going to say therapy, of course, because there's a lot more behind this idea that I brought this baby in a wrong way. You know, and that is judgment, right? That's from the community. That's the things we say. We judge how people have babies out of wedlock, in wedlock, with this person, you know, he was no good, you know, why are you with this person? You know, all these kinds of thoughts. And I saw something not too long ago where it was like a clip from the Wendy Williams show on Facebook. And then it was someone who was a friend who was saying that they weren't sure they were going to go to the baby shower because of how the baby was conceived. And I just think those kinds of thoughts are just why women are struggling the way they are with the whole pregnancy process. The fact that we're sitting here and judging how a baby came in, and that's why she's struggling with those feelings.
Thank you. Thank you.
I'd tell that mom it's okay. You're a good mom. Children don't need a perfect mom. They need a happy mom. And if it is hard for you to reach out for help, you know, because you are a good mom, you know, think about doing it for your little one. You know, you're reaching out for support so that you can be the best that you can be, not even for yourself, if you choose to think about it that way, but for your little one. I certainly feel like we should do things for ourselves, but if that's something that would help you wrap your mind around, you know, getting that sort of support that you obviously need, then, you know, that's okay. And I'd also say that a lot of people in our country in particular are not aware of the resources that are available to them. So certainly if you're feeling isolated or you're feeling like you don't want to reach out to someone that's already in your circle because of whatever negativity there is, then there are usually, you know, resources and programs and hotlines and things like that will then refer you to more resources and hotlines and things like that. There's always a way to get help that works for you, and you're doing a good job. So keep on pushing.
Thank you. Dr. Calina, you were about to say something?
Yes, I was. So there are hotlines that you can call. I have one for a mental health support chat line, and there's a postpartum, you know, one that you can specifically go into. I can give you guys that later. But I want to say two things that I know that everyone's heard, but number one, it takes a village to raise a child. Everybody knows that. And if your circle is making you feel shunned, that's not your circle. You need another circle. Okay, you need another set of friends that are supportive. I would like to think that my people that I'm closest with, no matter what I've done, they wouldn't shun me because of the mistakes I've made. I'm a human being. We all make mistakes. And if they're my friends, they accept me. They let me know that I'm wrong, but then they help to build me up. They don't tear me down. That's what I think friends should do. And another thing is that an empty cup can't pour out. You can't give to your baby if you're empty. If you're always trying to take care of yourself, you're trying to take care of everything. You know, I think that's what Alicia Keys is like. Even when I'm a mess, I still put on my vest with the S on my chest. Oh, yes, I'm a
Sing it.
woman. No, a regular woman, okay? And that is not a bad thing. You know, you super in the fact that you just, you know, did what you had to do. You gave birth to a child. So accept where you are and build yourself up from there. I go to church, so I have a good system where I can go to my church and they have resources. That may not be what you do, so I don't know whether you're in church or not. But so a lot of the churches still have resources, whether you go to that church or not. So I would say if you're not against going to a church just for help, they do have those resources. I do have the mental health support chat number is 1-800-944-8766, and the postpartum participant code is 73162#. So you can go in there and you can get some, you know, help, and you can talk with people because you obviously need to talk to someone else. It's not something that you could do on your own. You definitely need more people to support you in what you're going through. It's okay to need support. Please do not feel like you have to do it alone. No one can do this life alone. I would not be able to make it, and it's just me. So I know when you have someone else depending and supporting on you, you need to have someone to support you as well.
Thank you. Dr. Calina, would you mind typing that in the chat? Or
yeah, I'll do
otherwise,
it because you know how I am.
I know. If you don't do it, I'll type it in later. If you can't do it, I'll do it later.
Okay.
Dr. Michelle, do you have anything on that topic?
So I would tell this woman, just thinking, saying it carefully, that she's loved and that there's a lot of love in the world and community, and that the person who said this to her is putting grief into her mind and putting doubt in her ability to make that decision to have that child. And knowing that sexual relations can lead to pregnancy, and not letting her feel like she needs to fit in a certain mold because of judgment of somebody else. And if she's like me, 100 people could say 100 nice things, and one person would say something like that, and I'm devastated for not just like days, like months, like years. I still bring this up, and I said, put my head down and think, oh, I'm not good enough. I'm not here for my kids. Should I put them up for adoption? But just reminding her that there are different families. There are different ways that babies have those people to love them. There's trans birth families, there's gay birth families, there's polyamory where there could be one mom and there could be two dads, or one mom and another mom and a dad. There's just so many different things that we don't have to fit. Someone said it, maybe a religious role or a community, a society belief system, that she's there, like someone else said, that she had this baby inside of her for 9 months, taking everything, minerals and nutrients and all of that, the space that's taking up your body, and just realizing that your job is to take care of the baby, love the baby. And I think if her self-esteem got lower, it also makes it harder to ask for that help. Yeah. And then just thinking about trying to make a list of where I could use help, which is really hard. I'm one of those people that have a hard time asking for help. I'm really a supporter of support groups. So whether it's a group of people that she knows, even if it's like an old friend from, that lives in all the way across the country from grade school or something, just get at least, 1 or 2, 3 good people you can talk to, and you can focus on the joys of parenting and not what society is judging you. And then thinking about what type of resources are in the community. Someone said churches, other support networks. It doesn't necessarily have to be like single mom, but just a mom's group, whether that's early on. It could be online, it could be a Facebook group, it can be just a chit chat like this, like a Zoom group, and just trying to pull together some resources. I would feel as a naturopath and a doula, do what I can to be supportive and say, this baby is here for a reason, and that's the miracle of life. Like, this is not a mistake, this is not an accident. And your baby, when they're grown, will say, I was loved by not just my mother, but the community. And, will learn to stay away from toxic behavior or toxic talk directed at that family because of their dynamic. And then just realizing that, if in addition a therapist, adding like a licensed clinician to that, healthcare circle, that would be helpful too, because not only would you have your doula or naturopath or both, then you have another professional, so you kind of get advocates. You get advocates that are going to be there for you. You can schedule appointments. Like, friends are good to have and chit chat, but they're not always available. But if you could make a weekly appointment with this person, and if you can have a doula come over, so many hours a week, I think that helps, because it's scheduled. It maybe not, you can't, professionally be that close to them, but it's something consistent and something that can be ongoing. And like Dr. Williams had some phone numbers and different things. So as practitioners, we can pull together those resources and then check in and say, how's it going with that Facebook group? How's it going with talking to your old best friend? And then how is it going with, how you feel about your baby? Like quiet down the rest of the world and the old ideas and think, how is it right now when you're looking at it? And kind of being like, for people with PTSD, it's not PTSD, but just remembering, what's the day? What's the time? Where are you? Are you safe in your home? Are you fed today? Are you clothed? Or maybe not. Maybe you're cuddling in bed, and just try to look at what's going on in front of you and then work at trying to, in the future, deflect any of that negative energy towards them.
Thank you. Dr. Calina, Dr. Sims said that she would type that information for you. So if you would repeat it again slowly so that she can type it, that'd be great.
Yes, thank you. Sorry that I'm taking a lot of things.
No, it's no problem. It's no problem. It takes a village to run a
yes.
chat.
1-800.
Wait, what is this for? Which line is this for?
For the mental health support chat. Okay. So it's 1-800-944-8766. And there's a specific participant code for postpartum. You would type in 73162#.
Thank you so much. I think we're going to have to create another Facebook Live to talk about the coronavirus part of it, because I know that several of you wanted to talk about that. And so since that is such a big topic, I think I want to table that for the next time. But for the last few minutes, I do want to touch on the whole sex piece. So I don't want that to be forgotten. So each of you, if you have something to add about postpartum sex, have at it.
I definitely do. I would like to say, try and take it slowly. I definitely know the men are a lot of times excited because it's been 6 weeks, and they're waiting for the thumbs up. But a lot of times, moms, it's okay. Sometimes you have that extra baby weight and you're like, I'm not quite feeling sexy quite yet. Might not want to be in that place yet, just depending on where she is. Communication is going to be highly essential, especially that first time. Because remember, you've had a trauma that occurred down below, and you pushed a watermelon out of something that's like the size of a lemon, and there's scar tissue there. The area is still healing. Even after 6 weeks, it's still healing, especially like if you tore and you had stitches. Technically, yeah, the tissue's together, but it's still real sensitive there. There's still scar tissue there, and you want to make sure that, I just come straight forward with it. Lubrication. So you want to make sure that your wife or your partner is fully lubricated. That means you need to do some foreplay. You need to make sure that you're taking that time to make sure that she's ready before you go in. And you want to pay attention to penetration, how you're penetrating. It's like, again, like the first time, you want to be slow. You feel some resistance, pull out, go back in. You got to play with that, and you have to be able to communicate with each other. She has to be able to feel comfortable enough to say to the right, to the left, a little faster, a little slower, deeper, whatever the case may be. But being able to be comfortable as a unit, to be able to speak to each other. And if it gets to the point where, women, sometimes I tell them to change up the positions. Missionary is all good and great, but sometimes you have to change things up and try positions where the mom is the one who's in the lead, so she can change, the rate, the depth, however it may go, so they can make for a better experience. So I usually have that whole conversation. My patients are accustomed to me just being like, no, this is how we do, and working through that. But I don't want to shock everybody like, oh my gosh, she's a multiple physicians. And then the last thing, is for the men, sometimes it can be hard for them because the breasts were for them. prior to them having a baby, and now the breasts belong to the baby, and it's like, it's weird. I don't want to touch them. There's milk, and so those are things that couples need to be able to talk their way through, lubricating properly, trying different types of lubrication, hopefully something more natural based, and just being able to just communicate during the actual act, before and after, so that you can make for a more pleasant experience.
Thank you.
I would just like to add, I totally agree. In regards to lubrication, sometimes something as simple as a vitamin E oil, E as in epsilon. Sometimes something that simple can help, because it's very viscous, right? So it can alleviate some of the feelings that might occur during penetration and help with that lubrication. You can incorporate that into the sexual activities so that, again, you're kind of building up. The other thing is, as you mentioned, the breasts, which were, the husbands or the spouses or whatever, now they're kind of property of the baby. But remember, during sex, you increase different hormones, including oxytocin, which honestly, just a 30-second hug will cause your, or I don't want to think it's 30 seconds, it'll cause your oxytocin to just jump up, right? So think about this. Oxytocin also helps with what? Making milk, okay? So ladies, practical, real practical. Wear a bra and make sure you have some insert breast inside, because it's not uncommon for you during intercourse to start increasing your lactation or leakage. So that would just be kind of more practical things to add to Dr. Williams.
Thank you.
Oh, and on that note, I was going to say, as we were having the conversation about getting used to having sexual intercourse, you mentioned the breast, but, also if there might be bleeding, putting a towel down or, because like Dr. Karina said, areas may have been stitched up, and sometimes the first time won't be the best time, and you may have to keep trying. And I think as long as the commitment is there to keep trying and to be patient, because I know sometimes the woman doesn't want to have sex, right? But we should be having conversations about partnership and how we're going to do things. And so as a couple, figuring out the best way to proceed, but at least trying, because I think that if the trying doesn't happen, that's where the bitterness and resentment can come up. So even if that just means a little bit or doing some other types of foreplay, I think just having that emotional connection, that physical attraction, and building that back up again may just help, create a new foundation for the new sexual life that you may have.
Thank you. Dr. Michelle, did you have anything to add?
Sure. I just wanted to add to family planning, birth control. I didn't know I was in my early 20s when I had my daughter, and I only nursed, and then I got pregnant with my son, and I thought, oh, if I nurse and, do that day and night, that I wouldn't get pregnant. So just the family planning and, having that patience and taking things easy. The lube, yes, very important, because things changed from before the baby came. But just having that talk with the practitioner is good in case you want to use different forms of birth control. Condoms makes it easy because you can grab those before the baby's born and, have them already. You don't have to go in for an appointment. So, at the minimum, have the condoms inside the house already, so that time might be spontaneous. Like you might say, oh, at 6 weeks and 3 days, let's, try it. But that doesn't always happen, that type of planning. Yeah. And then just realizing, someone mentioned the changes in the body. I think sometimes the changes and the stretch marks, sometimes the mom's self-esteem could be a little bit different, new or changed or just unknown, and don't look at me there right now, I don't feel as beautiful. But just knowing that the partner can say, you are beautiful, you're the person I chose, you're the person I'm with right now, and this, we have our beautiful baby. So it's kind of that whole, recommitment to each other that comes. But then, with the birth control and birth planning, or family planning, just not really having any surprises, especially with the bleeding. And then is that the postpartum bleeding, or is that, menstrual bleeding? Just making sure people talk to their practitioners and note those dates and the consistency and all the changes that happen there, because sometimes it's a big blur.
Thank you. Dr. Mai.
You're a whole new person postpartum.
Mm-hmm.
Your body is a whole new body. So for you and your partner or partners, enjoy, it's a whole new person. And really, you're going to have whole new sensations. So the tissues, the degree of swelling, the degree of tenderness, even with the bones of your pelvis setting back in place, it's going to feel different. And I'd say, hopefully don't stress, the person who's just giving birth, don't stress them out about it, or pressure them, of course, just like any time of life. But of course, take it slow and to really enjoy, because, you're going to be more sensitive those first couple times. So, go slow, take memories, make memories, and enjoy all those new sensations that your new body is giving you.
Thank you. So we've been on for a while. We're going to go ahead and wrap it up. What I'm going to ask you doctors to do, those of you who can, go ahead and type your contact information in the chat while, so if everybody types now, and then each of you will kind of mention who you are and how people can get in touch with you. Let's start with Dr. Calina.
Yes. Do you want them to know who I am and how to get in touch?
Yeah, how to get in touch with you, your social media, your website, how can they reach you?
Yes, I have a Facebook page. My name is Dr. Crystal Calina, NMD, LLC. So you can contact me on Facebook. I also have Instagram. So it's literally just my name. So you can just always just type me right on in. I have my private office. We're going to type that information in and put it into the chat for us.
All right. Let's have Dr. Mai.
Hey again, Dr. Mai, Heath ND. So you can find me on my website. It's www.myheathnd.wordpress.com. You can find me on Instagram at Dr. Mai ND. I'm also on Twitter. I'm on Facebook and LinkedIn. So certainly reach out to me. Like I said, I am a full spectrum doula and I'm a naturopathic doctor. So irregardless of family needs, or regardless of family needs rather, or, place in life, reach out and we can certainly get you some resources and some services.
Thank you. Dr. Michelle, how can they reach you?
So my naturopath website is tower-of-health.com. There's some links to my other accounts on there. On Facebook, I do have an account. I have a Doula Orange and Tower of Health. And I can, when the video gets reposted, I'll put the exact link in there. And I can be reached at towerofhealth1@gmail.com.
Thank you. Dr. Lahnor.
In website, but you can reach me at www.lovelullabies.org. My email, you can actually just send an email through that website, and I have quite a few things to come in the near future, so definitely stay tuned. I'm really excited about what I'm in the process of developing for women in their postpartum or time frame, I guess, or fourth trimester, which we totally just redefined today.
Thank you. Dr. Pierre.
My contact information is drjpierre.com. You can reach out there to me. You can either leave a message or send an email, or all the information is there, the phone number. On Instagram, I am at drjpierre. And on Facebook, I'm at Dr. Jennifer Pierre. And I deal with primarily women's health, and for most women trying to get pregnant, that's what I love doing, and working on hormonal imbalances and things like that, and of course the postpartum period. So please reach out if you're interested in any of those things, Connecticut and beyond.
Thank you. And I am Dr. Turshá Hamilton. I can be reached at www.drturshá.com. That's DRTURSHA.com. Instagram, Facebook, Twitter, Pinterest, which I don't even use, YouTube. I can be found at Dr. Turshá, DRTURSHA. And of course, you want to follow Indies of Color on Facebook and Instagram, where we have all of the Indies of Color information, so that it's like a central hub for all things Indies of Color. Thank you all for watching. Thank you for your comments. Thank you for being with us for as long as we were on, and definitely we'll have them back. If there is a topic that you want discussed, please send Indies of Color a private message. Let us know, and we will do what we can to get that in the rotation. Thank you all very much for joining us. Make sure that you share this video, and we'll see you next week. Take care.